Well, Janet has come to us because she's had some veneers fabricated from past clinching and bruxism damage, and we've had to fabricate an NTI to protect all that dentistry. So we've chosen to do an upper NTI versus a lower for this very reason. We want to protect those upper veneers. The reason she's coming back to us a few weeks later is because the discluding element on the NTI seems too long for her and it's annoying. Go ahead and put this in for us, Janet, and we can see what is bothering you here. So go ahead and just tap your teeth together, tap, 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 and jet your jaw out as far as you can go. Great. Well, I can see already that she has some excessive material here, which the laboratory will sometimes add 2 millimeters to the protrusive measurement that you send in because they want to buffer and make sure that if you have too much, that you can always adjust it back, but it's better than maybe needing more and not having enough. So in her case, we do have a little excess, easy to remove. However, we have a technique that we could use to also see if we can not only take that 2 millimeters off, but maybe even a little bit more in her situation. And it's a Sharpie marker technique, and it's really easy to use. So let me show you how to do that. Basically, I'm getting the whole top of the discluding element where their teeth are opposing, and color that in like that. And I'm going to have the patient wear this for about a week. We're going to have her back, and we're going to see what her activity looks like at night, because just because she can, while she's awake, move out to the end or close to the end of this discluding element doesn't mean she will. So based on those patterns that I see back in a week, I can maybe reduce even more than the 2 millimeters I planned on removing today. Okay, so the patient has worn the device for about a week, and we're able to see the parafunctional activities that she does at night, and it definitely looks like she has some protrusive back and forth movements for sure, and then she's going off to the side and some lateral excursive movements as well. But you can see there's plenty of excess discluding element hanging off the edge that most likely, if this is what she's doing in a week, most likely she's not going to go out this far. So I feel comfortable reducing probably a millimeter back away from this pattern here, I should say. So I'll remove this excess discluding element, leave a little bit, maybe a millimeter or so, away from where she's wearing to kind of buffer in case she loosens up a little bit more over time and moves out just a little bit further. So I'm going to go ahead and reduce this excess material here. But, you know, again, do not be overly aggressive as far as going back to those wear patterns. If the back teeth can come together at all, or the canines, then you're going to have clenching intensity again. So I'm going to go ahead and smooth this up a little bit more, and then I'm going to try it in and see how it feels to the patient. Okay, so I went ahead and I adjusted the discluding element to remove some of that excess material that was annoying to Janet. I could see where her nighttime wear patterns were, and I stayed about a millimeter away from the most protrusive of the nighttime wear patterns. So I'm going to try this in, and I'm going to take a look and make sure she still can't jump over that discluding element too much there, and make sure it's still functional. Go ahead and try this in. Now go ahead and look straight ahead for me. I'm going to have you just jet your jaw straight out as far as you can. Great. I know she still can't jump up over that discluding element and then have any kind of contact with canines or posterior teeth, so I feel great about that. And you're feeling a lot better with it then too? Wonderful. All right, great. It's that simple.